You're welcome to Healthcare Today, your most informative healthcare program meant to educate us on very common medical conditions that is prevalent in Nigeria, and also to point you to the direction where you might receive adequate care right within the country, because there's always this thinking that we don't have good healthcare services. But I tell you, there are lots of good healthcare services happening in Nigeria, and we are here to inform you just in case you might need help in that direction. This morning, we're going to be talking on diabetes in Nigeria. I mean, it's one of the common medical conditions you come across in Nigeria. As at 2021, statistics show that about 24 million Nigerians had, diabetes. What is diabetes? Well, commonly, just layman definition would be, excess blood sugar in circulation, elevated levels of blood sugar, in an individual far above the normal range that is acceptable for normal body functions. Now, simple testing will, show you what your level of blood glucose is at any point in time. Now, when there is elevated blood sugar in this way, it creates its own set of problems. How do I know that somebody has diabetes? From symptoms, you might hear the individual saying that I feel very thirsty often, I drink a lot of water and yet I'm thirsty. I pee frequently, and all of that. So if you're passing urine quite frequently, large volumes of urine, drinking a lot of water, and yet getting thirsty all the time, then you might want to check if there is possibility of high blood sugar in your circulation. Okay, the other thing might also be weight loss. Somebody who has diabetes that is already established may also have weight loss. When this happens in children, because you could have childhood diabetes from age 0 to 14, childhood diabetes occurs, and this same set of symptoms may be there. But additionally, a child with diabetes may then have bedwetting, because of the frequent urge to pass urine. The child may be bedwetting in his sleep. So these are some of the symptoms an individual may have, and therefore it's important, once that is happening, to go for medical attention. Seek medical attention and get tested. Simple test, like I said, just to check your blood glucose levels. Why is it important to check? Because it's a disease, like I said earlier, that could lead to several other complications. And the complications of diabetes can be really troubling. Because it affects blood vessels, causing thickening of blood vessels, causing, increased peripheral resistance in the long term. It could then lead to damage to blood vessels in the brain, and when that happens, portions of the brain may be denied of blood circulation, leading to infarcts. The person can end up with stroke. When it happens that the changes are happening in the heart, it could lead to, blood vessels in the heart, being affected such that the heart is denied of blood supply to the muscles of the heart. And that also could lead to, heart attack and all of that. People who have their blood vessels blocked in the legs, for instance, because of diabetes, also has, they've had to have amputation of the leg, because, the leg simply goes dead without blood supply, becomes gangrenous, as we call it. So there are many complications, that diabetes can cause. Today, if you go to a kidney center and check the cause of kidney failure, in about 8 out of 10, it is either caused by diabetes or caused by hypertension or a combination of both, because these are disease conditions that also affect the kidneys, and knock off those kidneys, and then the individual may end up requiring kidney transplant, at the onset requiring dialysis, and then eventually requiring the kidney transplant. Diabetes is real. The problem, again, is that more than half of the people with diabetes in Nigeria are not diagnosed, so they don't know they have it. Because they don't know they have it, they also get subjected to more harm when they have other disease conditions. And I will explain. We've had situations where somebody with already, existing high blood sugar in circulation because of diabetes gets, sick with malaria, diarrhea disease, or any other condition, and goes to the hospital. And the first thing the hospital will do will be to put the patient on drip and begin to infuse more glucose into the person. Some people have literally died out of this because the extra glucose you're pumping into the person without checking the level of blood sugar in the first instance can simply tip the person into diabetic coma. And this has happened severally, and this has led to untimely death, that people explain away as either, witchcraft or something. So it's important because the disease runs in families. There's a genetic predisposition. If you therefore have parents, uncles, aunties, or people in your family who already have been diagnosed with diabetes, it's important that you keep an eye on it by regular checkups, because once there is a genetic disposition, it means the tendency might be there that people in that family can come down with high blood sugar along the line in the course of their life, especially from age 45, 40, 45 and above. This is when you should be more conscious, But having said that, like I said earlier, there is childhood diabetes, there is juvenile diabetes. Childhood diabetes, we call it the type 1 diabetes, from age 0 to 14. Oftentimes what happens in that case is that, the immune system of the individual simply destroys the pancreas, and therefore insulin is not produced in sufficient amount, and then blood sugar control is lost. So that child ends up with childhood diabetes. There are teenagers who will also have childhood diabetes, usually from their teens, and commonly girls are more affected than the boys. So any symptom that looks like what I mentioned at the beginning should be checked out, whether it's a child, whether it's a young adult, or whether it's an elderly individual. So that's, generally what we want you to know about diabetes is real. Diabetes is, one of the diseases that have high prevalence in Nigeria. It's something that is treatable. We also have an association called the Diabetic Association of Nigeria. They offer seminars, they do workshops, they do conferences, they do medical outreaches, just to educate, to help Nigerians suffering from the disease to get, medical assistance, and to educate them on how to handle their health conditions. So this is something that is available, and you can take advantage of that. In controlling diabetes, it's important to eat healthily. One of the reasons why we have high incidence of diabetes in Nigeria at the moment is because of unhealthy diets, sugar-laden diets. We have people are not exercising as much. Obesity is also on the increase. smoking is part of the reasons some people end up with diabetes. So if you watch, to check these things I'm talking about, you may just save yourself the agony of having high blood sugar that could then subsequently lead to other complications. We'll be talking more on this and some other topical issues as we come back, with another broadcast. It's been Healthcare Today, your informative healthcare program, just to keep you updated, on the things that you should know about your health. Thank you.